Have you ever found yourself tossing and turning at night, unable to get a good night FS rest? If so, you're not alone. Insomnia is a condition that affects millions of people around the world. It's not just about struggling to fall asleep, but also about staying asleep or waking up too early, even when you have the chance to sleep. This constant cycle leaves you feeling exhausted, irritated, and drained during the day. In fact, approximately 10% to 30% of adults experience some form of insomnia, and about 10% of the population deals with chronic insomnia, which lasts for a month or longer. It's a problem that doesn't just disrupt your sleep, but can also affect your mood, your energy, and even your ability to function throughout the day. So if you've been battling sleepless nights, know that you're not alone, and there are ways to address this challenge. Let EFS start by understanding the different types of insomnia, as this can help us better grasp what FF's going on when we experience sleepless nights. First, there's acute insomnia. This is the kind of sleep disturbance that lasts for a short period, usually less than a month. ITF's often triggered by something temporary like stress changes in your environment or even travel. For example, maybe you're dealing with a stressful work deadline or adjusting to a new routine. These disruptions can throw off your sleep cycle, but the good news is acute insomnia often resolves on its own once the stressor is gone. On the other hand, chronic insomnia is a more persistent issue. It involves sleep difficulties happening at least 3 times a week for 3 months or longer. This can lead to serious problems with daily functioning, like feeling constantly tired, irritable, and unable to focus. Chronic insomnia can often be linked to ongoing stress lifestyle factors or even other underlying health conditions. Another way to classify insomnia is by whether or not ITF is related to other medical or psychological issues. Primary insomnia stands on its own. ITF's not caused by any other health problem. Essentially, ITF's insomnia that happens for no obvious reason. On the flip side, comorbid insomnia occurs alongside other health conditions. This could be anything from anxiety and depression to chronic pain or other medical disorders. In these cases, insomnia often worsens the symptoms of the other condition, creating a tough cycle to break. So if you're struggling with sleep, ITF's important to know which type of insomnia you're dealing with, because it can help guide the right approach for treatment. So why does insomnia happen in the first place? The truth is, there's usually more than one reason. Let's start with the mind. Mental health and emotional stress are often at the root of insomnia. When you're dealing with stress, anxiety, or even depression, your brain stays in a state of high alert even when your body is tired. Thoughts race. You might replay conversations, worry about deadlines, or overthink problems. And when your mind is so active, it becomes extremely hard for your body to unwind and drift into sleep. This is especially common at night when distractions fade and your thoughts get louder. To make things worse, many people start to worry about not sleeping itself, watching the clock, counting the hours left before morning. This creates a cycle of stress. You're anxious because you can't sleep, and you can't sleep because you're anxious. Over time, this pattern trains your brain to associate bedtime with frustration and worry, instead of rest, making insomnia even harder to break. Then, there's lifestyle. One of the biggest sleep disruptors is how we live day to day, especially in the evening. Take screen time, for example. Scrolling through your phone or watching TV in bed might feel relaxing, but the blue light from screens actually tricks your brain into thinking ITF's still daytime. This stops your body from making melatonin, the hormone that helps you feel sleepy. And if you stay up late one night, then try to sleep early the next, your internal clock or circadian rhythm gets confused. ITF's like giving your body jet lag without even leaving your house. Your brain doesn't know when ITF's supposed to feel sleepy or alert. The truth is, your body thrives on routine. Going to bed and waking up at the same time every day, even on weekends, helps regulate your sleep cycle. But when that rhythm is thrown off, your sleep can become shallow, restless, or delayed altogether. If your bedroom is noisy, like with traffic outside a snoring partner or even a humming appliance, your brain stays slightly alert, making it harder to fall into deep, restorative sleep. And sometimes, even tiny sounds can wake you up briefly without you realizing it. Temperature also matters. A room that's too hot can cause you to toss and turn, while a space that's too cold might make it difficult to relax fully. Most people sleep best in a cool, quiet, and dark environment, like a cave for your brain to recharge. In short, when your surroundings aren't sleep-friendly, your body struggles to stay in deep sleep, even if you don't fully wake up. And we can't ignore medical conditions. Certain health problems can directly interfere with your ability to get deep, restful sleep. For example, chronic pain from conditions like arthritis, fibromyalgia, or back problems can make it hard to get comfortable in bed. You might toss and turn, wake up often, or feel sore even after a full night's rest. Then there's sleep apnea, a condition where your breathing repeatedly stops and starts during sleep. This disrupts the normal sleep cycle and often leaves people feeling exhausted, even if they don't remember waking up. Neurological disorders such as Parkinson's disease or restless leg syndrome can also interfere with the brain's ability to regulate sleep, causing frequent awakenings or unusual movements during the night. In all these cases, poor sleep isn't just a problem on its own. ITF's a symptom of something deeper. That's why ITF's so important to identify and treat the underlying medical condition when the root issue is addressed. Whether through medication therapy or lifestyle changes, sleep often improves naturally. Finally, certain substances can work against you even if you don't realize it. Take caffeine, for example. ITF's found in coffee, tea, chocolate, and even some pain relievers. If you consume it in the afternoon or evening, it can stay in your system for hours and block the brain's natural sleep signals, making it hard to fall asleep or stay asleep. Then there is nicotine, a stimulant found in cigarettes and some vaping products. It may feel calming at first, but in reality it raises your heart rate and keeps your brain more alert, making it harder to wind down at night. Alcohol is tricky. It might help you fall asleep faster at first, but as your body processes it during the night, it actually disrupts your sleep cycle. This leads to lighter, more fragmented sleep, and you may wake up feeling groggy or unrested even after a full night in bed. And don't forget about medications. Some common ones, like decongestant steroids or certain antidepressants, can have side effects that interfere with sleep, either by increasing alertness or disrupting your natural sleep rhythm. That is why it is so important to be aware of what you're putting into your body, especially in the hours before bed. Understanding these causes is the first step to getting your sleep back on track. If any of these sound familiar, don't worry, we've got plenty of practical solutions coming up. Let us take a closer look at why insomnia happens, not just what causes it, but what's actually going on in the body and mind when sleep won't come. First, when you're under stress, your body produces a hormone called cortisol. This is your natural fight or flight chemical. It helps you stay alert and focused during emergencies. But when cortisol levels stay high, like when you're constantly anxious or overwhelmed, it sends the wrong signal to your brain. Stay awake. Be on guard. This creates what is called a hyperarousal state. Even if your body is tired, your nervous system stays active. Your heart beats a little faster. Your brain keeps turning over thoughts. You might be lying in bed with your eyes closed, But your body doesn't get the message that ITF's safe to relax. That was why people with insomnia often say, "Gee, I'm exhausted, but I just can't fall asleep." Or they wake up in the middle of the night and can't get back to sleep. ITF's not laziness. And ITF's not just in your head. ITF's your stress response stuck in overdrive. Then there's the mental side of things. Negative thoughts like, "Gif I'm never going to sleep," H, or G, "What if I can't get through tomorrow?" which can actually make insomnia worse. These anxious thoughts become a habit. And over time, your brain starts to associate bedtime with frustration and fear not rest. Another key piece is your circadian rhythm, your body's natural sleep-wake cycle. This internal clock tells you when to feel awake and when to feel sleepy. But if you're staying up late using screens at night or changing your sleep schedule, often your rhythm can fall out of sync. That makes it even harder to get quality sleep even if you feel exhausted. So insomnia is NFT just about not sleeping. ITF's a combination of stress mindset and a disrupted internal clock. What happens after a bad night of sleep, especially when it turns into a pattern? When you're not sleeping well, it shows up in your daily life. You feel tired during the day. Your focus is off. Even small tasks feel harder. And over time, your mood takes a hit. You might feel more irritable, anxious, or even down without knowing why. But it doesn't stop there. When you consistently miss out on deep, restful sleep, your body doesn't get the chance to repair itself. This puts extra stress on your system and increases your risk of high blood pressure. Your heart ends up working harder than it should even while you sleep. Lack of sleep also affects how your body handles blood sugar, which can raise your chances of developing type 2 diabetes. And then there's your immune system. Without enough quality sleep, it weakens. That means you get sick more often, and it takes longer to recover. And ITF's not just your health that takes a hit. Chronic insomnia can affect every part of your life. When you're constantly tired, ITF's harder to be present with the people you care about. You might find yourself getting irritable, short-tempered, or emotionally distant, even when you don't mean to. At work, it can be tough to focus, meet deadlines, or stay motivated. Your productivity drops, and even simple tasks can feel overwhelming. And over time, this wears on your mental well-being. You start feeling frustrated, disconnected, or even hopeless, like everything is just a little harder than it should be. If you're struggling with sleep, try this one of the most proven methods to treat chronic insomnia: cognitive behavioral therapy for insomnia, or CBT-I. Now, don't let the name intimidate you. CBT-I is NFT about lying on a couch, talking about your childhood. ITF's a practical, structured approach that helps you change the way you think about sleep and the habits that might be making it harder to rest. In fact, doctors and sleep experts recommend CBT-I as the first-line treatment for long-term sleep issues. Why? Because it works. And more importantly, it helps you build better sleep without relying on medication. So how does it work? It starts with cognitive therapy, which helps you identify and challenge negative thoughts that keep you up at night. For example, you might catch yourself thinking, "I'll never fall asleep tonight," or "If I don't sleep tomorrow, will be a disaster." These kinds of thoughts create unnecessary pressure and anxiety, and that anxiety makes it even harder to fall asleep. Cognitive therapy teaches you to replace those thoughts with calmer, more realistic ones like, "Even if I don't sleep perfectly, I'll still get through the day." Next up is stimulus control, and this one EF's all about retraining your brain. If you use your bed for lots of different activities, like scrolling through your phone, watching Netflix, answering emails, your brain stops associating your bed with sleep. Instead, it starts linking it with being alert, entertained, or even stressed. Stimulus control flips that script. The goal is to teach your brain that your bed is for one thing, only sleep. So here's how it works. Use your bed only for sleeping and maybe intimacy, not texting, not eating, not working. If you can fall asleep within 15-20 minutes, just lie there, tossing and turning. Get up, go to another quiet space and do something calming, like reading a book, doing deep breathing, or listening to soft music. Only go back to bed when you actually feel sleepy. Doing this consistently helps your brain rebuild that strong connection bed equals sleep. And over time, it becomes easier to fall asleep and stay asleep. There's also something called sleep restriction therapy. And yeah, the name sounds a little harsh, but don't worry, ITF's not about forcing yourself to stay awake all night. The idea is simple. Only spend time in bed that matches how much you're actually sleeping. Let's say you're in bed for 8 hours, but you only sleep for 5 of them. That means your brain is getting used to just lying in bed awake, which actually trains it to associate the bed with restlessness instead of sleep. So with sleep restriction, you've cut down your time in bed to those 5 hours just for a little while. This makes your body feel sleepier and strengthens the connection between bed and sleep. Once your sleep becomes more solid and consistent, you slowly increase your time in bed again until you're sleeping better for longer. ITF's like hitting the reset button on your body's internal clock. And yes, it takes a bit of discipline at first, but it often leads to deeper, more efficient sleep in the long run. And let's not forget about relaxation techniques, things like deep breathing meditation or progressive muscle relaxation. These can help calm your nervous system and ease your body into sleep mode. Finally, CBT-I includes sleep hygiene education. That means building healthy habits like keeping a regular sleep schedule, creating a calm bedtime routine, and limiting caffeine or screen time in the evening. When you put it all together, CBT-I gives you a full toolkit for better sleep, backed by science and proven by results. And the best part, these changes don't just treat insomnia, they empower you to take control of your nights and wake up feeling truly rested. In addition to traditional methods, an effective technique rooted in Eastern medicine can be used to improve sleep quality. Here's a simple practice that could help each night before going to sleep. Focus on massaging the palms of your feet, particularly the soles, which are considered key areas to promote relaxation. A few minutes of gentle, soothing pressure here can help ease tension and support a peaceful night's sleep. Next, gently rub the point between your eyebrows for a few minutes. This spot, often called the yin-tang point, is believed to calm the mind and help your body get ready for sleep. Note people with low blood pressure should avoid this point as it may cause further hypotension. However, it's beneficial for those with normal blood pressure and especially helpful for people with high blood pressure. This method blends gentle physical relaxation with the soothing effects of acupressure to help your body unwind and achieve deeper, more restful sleep. Sleep is an FT, a luxury ITF's your body's reset button. And with the right approach, you can get it working for you again. So, when should you reach out for professional help? If you've been struggling with insomnia for more than 3 months and ITF's starting to affect your mood, your energy, or your ability to function during the day, that's a clear sign ITF's time to talk to a healthcare provider. Also, if your sleep issues come along with signs of anxiety, depression, or another health condition, DFNFT, ignore them. Trouble sleeping is often connected to how our minds and bodies are feeling overall. Getting to the root of the problem can make a big difference. And here's another reason to get help. If you've already tried lifestyle changes, natural remedies, and nothing seems to be working, ITF's okay to ask for support. Sometimes we need expert guidance to break the cycle and start healing. You'd have to figure this out alone. At Health 2660, we believe good sleep is not a luxury. ITF's a foundation for your health. If this speaks to you, hit that like button and subscribe for more science-backed tips that actually work.